Hi everyone. Welcome to Making It on Monday. And I'm pretty excited today because we're going to be talking um, a lot about like the tongue and the pulse. And so many of you have come in before to our clinic, or to maybe you've just gone into another acupuncture clinic, or maybe you're just thinking about acupuncture and Chinese medicine. You're kind of curious about how it works, and you've heard of the tongue and the pulse. But most people are quite curious to find out what is going on when a Chinese medicine practitioner takes your pulse and has a look at your tongue. It's a diagnostic method that we use. And most patients are quite curious to find out what we're finding out about you. So today we're going to talk all about the pulse. We're going to go into in depth, no pun intended, into what we're looking for and what the different feelings are. And as we go along, you might want to like even just start feeling your pulse as I'm talking about the different qualities, and see if you can pick up on any of the things I'm talking about. Then we're going to move on and we're going to talk a bit about the tongue. And again, you might want to have a mirror handy so you can poke your tongue out and have a look and see if you can see anything that I'm talking about, and see if it's relevant for you. So tongue and pulse is something that we learn in Chinese medicine school. So, for Chinese medicine practitioners, we normally do a 4 or 5 year degree, and getting the tongue and the pulse right is really, really important. So we spend a long time learning all about this, with our supervisors, making sure that we really understand the different qualities, and so we can assess people in this way. And it's quite unique, I guess, to Chinese medicine to feel the pulse and look at the tongue and really understand what's going on. And so you might be asking why the tongue and why the pulse, like what the, which is fair enough. So in Chinese medicine, they're often looking at microsystems, which means it's just a small little part that represents the whole larger part. So the pulse is considered like to be reflective of what is going on in your overall body. And the different pulses represent different organs and different systems. We're going to go into that. And the tongue's the same thing. So it's a microsystem, and with different areas represent different parts of the body, different systems, and how its overall appearance means lots of different things. So we're going to talk all about how it all kind of works, how it rolls. So yeah, if you don't have a mirror, go and grab one. If you have a have a minute, I really recommend just trying to feel what I'm talking about as we go along. So to start off with, today we're going to start talking about the pulse. And in Chinese medicine, we feel the pulse on both sides. So we feel it on the left. This is my left, even though it might be looking right to you. The left and the right hand side. In Chinese medicine, the left has got a lot more to do with yin, which is kind of got to do with like the fluids. It's the more kind of feminine aspect, more to do with like kind of like soothing yin fluids, substances, all of that sort of thing. And some of the organs in the body are considered to be more yin than yang. The right hand side is the opposite. It's more got to do with the yang in the body. So that's like the heating, warming element that really kind of gives you energy and life force. So we're kind of really assessing your energy when we're feeling the right hand side. And so the right also has organs that are associated with that are more yang. Yeah. So we're going to go into that. The other thing that's really worth mentioning is that both pulses, we feel them actually in three positions. So I'm going to today be talking about the first position, which is the one closest to your wrist, which we feel, and it's just after the wrist. The second position, and then the third position. And this is you. If you've come to a Chinese medicine practitioner, they'll be feeling your pulse with all three positions. So when you're at home, you just want to put your finger just past your wrist, and then you can start moving it down, 1, 2, 3. They're normally almost right next to each other. And you can do that right now, maybe have a feel either side, and you might feel that if you push down there might be a different quality on each of these positions. One might be weak, one might be strong, but we're going to go into a bit more of what that means. So we feel that on three positions on both sides, and that's because we want to know what's going on in all three areas. And what are the three areas? I talked about how it's a bit of a microsystem. So, what are three areas? So, the first area, the one at the top, has got to do with the top of the body. So, the organs and the systems at the top of the body. So, on the left hand side, the top would be the heart. Um, and on the right hand side, the top would be the lung. So we can feel sometimes if these pulses are have particularly weak, or if there's something kind of going on there, like the energy is not moving very well, what we call stagnation, energy to stagnation. Then we might sort of start asking you questions about what's going on. Maybe if it's got to do with the heart, it might be something to do with you having palpitations or not sleeping very well. And the lungs, have you had a cough or a cold or any kind of tightness in the chest or respiratory issues? So, first pulses on the left, we've got the heart, and then on the right, we've got the lung. And then we're going to move on to the second area, and this represents the middle section of the body and the organs in the middle section. So here we've got things like the spleen and stomach, which have got to do with digestive system, and we've also got the liver and the gallbladder. So on the left side, we've got the liver and the gallbladder. So usually we can just talk about this as the liver. The gallbladder pulses a little bit deeper. So we feel how the liver is going. And in Chinese medicine, the liver's got a lot to do with stress as well as its function to kind of, clear and detoxify the body and detoxify the blood. So it's got to do with nervous tension and stress, and how well the energy is moving in the body. So sometimes with this one, what we might feel is a pulse where the energy isn't moving as well as it could. And sometimes we talk about that as being wiry, like a wiry pulse. So if you ask your practitioner and they say, oh, your liver is a little bit wiry, it means the energy is not moving as well as it could in the liver, and we want to balance out the liver. And then on the right hand side, as I said, it's got more to do with, this side's got more to do with the yang, but also the blood, and the spleen and the stomach. So in Chinese medicine, we do actually make our blood a lot to do with how we digest things. So that's partly why this has got to do with it. So the spleen and the stomach in Chinese medicine are going to have a lot to do with how your digestive capabilities are. And sometimes in this one we might feel a different quality. It might feel very weak, or it might feel again like the energy isn't moving very well. Sometimes we'll describe this pulse if your digestive system is a bit weak and a bit sluggish. We'll describe this pulse as to be a bit slippery. And I'm going to go through what all the pulses, the different kind of qualities, and you can kind of try and feel them all. But yeah, if you can feel slippery, which is almost like a pearl kind of going through instead of there just being a nice strong pulse. It feels a bit sort of slippery, a bit sort of sluggish. And if we felt this, we'd think, oh, I think the digestive system's a little bit weak and we need to really work on that, and also the lymphatic system. And then lastly, we're going to talk about pulses right at the very bottom. So these are the kidney pulses. And these kidney pulses, in Chinese medicine, you've probably heard us talk a lot about how the kidneys have a lot to do with the reproductive function, and they do. And so we really want to check these out when we're feeling your pulse if it's got to do with fertility. So from a Chinese medicine point of view, you really need a reservoir of energy, and that is called in Chinese medicine, we refer this to as like the kidney pulse, and this is what fuels up and regulates your reproductive system. So these pulses are really important, and these are the pulses we always want to strengthen up when we're working on people for fertility work. And again, on the left side, it's all got to do with yin. So when we're feeling this one, we're feeling like things like the more kind of yin components in your body. So when that comes to fertility, it's got a lot to do with like the fluids. It has a lot to do with the quality of like the structures, like the eggs, all the kind of nourishing aspect of the body and your reproductive system, how well it's nourished. So that's what we're feeling when we're feeling the kidney yin. So you can have a feel and see if you can feel that pulse. If it's nice and strong, that's awesome. That's exactly what we want. And then if you are looking on the right hand side, and then again you're feeling like the third one down, it is the kidney yang. And so the kidney yang Again, it's got more to do with like the more kind of fiery, warming, and energetic component. And when this has got to do with fertility, this has got to do with, you know, how warm your body is, how well things are kind of getting metabolized, um, and often, yeah, with kidney yang has got more to do with, you know, your hormones and things like that. So, uh, sorry, just checking the volume still working. It looks like it is. Cool. Um, yeah, so that's kind of the lowdown with where the positions of the pulses. And like overall, what we're trying to feel is if the pulse is fast or if it's slow. And if it's fast, this means that there's like might be a bit more heat in the body. It's a bit more yang. It's moving really quickly. And slow, a little bit more yin. So we're trying to feel the quality, whether just how fast and how slow the pulses are. We're also trying to feel about the strength of the pulses. So, is there a lot of energy there and a lot of blood flow there, or is it weak and sort of slight? And sometimes we'll, you know, we might even kind of call it things like thready if it's quite a weak pulse. We're also trying to feel how well the energy and the blood are moving in those organs. So whether it's nice and smooth or conversely, it's rough. And sometimes when the energy is a bit rough, we talk about it a bit more like it's choppy or wiry, which I think I talked about a little bit in relation to like the liver pulse can sometimes be a little bit what we call wiry. And that means the energy isn't working as well. And people who have a bit of a wiry are more likely to have a bit more nervous tension, feel a little bit more frustrated. So, um, lastly, the other kind of qualities of what I talked about with being kind of slippery. And this means that things are just a bit sort of sluggish. Your lymphatic system might not be working as well as it could do. And so you're just a little bit, things are just a little bit sluggish and we really need to get things moving. And that's kind of like it feels like they talk about it feeling like a pearl. So have a feel of your pulses and see if you can feel any of these qualities. Another quality is if the pulse is quite thin, we might call it thin or thready, where it's, you know, not very, the pulse isn't very big. And that's got to do with there not being, being a limited amount of blood in the system. So that is your pulse. So I hope you found that really interesting and have a feel and see what you can find. Write in the comments below what you think you've got. If you want to share with the group, I think it'd be really fun for us all to kind of share what we think our pulse is, and you can ask your practitioner what it is and see if it marries up with what you've got. Okay, and now we're going to move on to the tongue. And the tongue is pretty cool, and people are often like, why are you looking at my tongue? You know, why do you want to look at my tongue? Ah! And often people are a bit embarrassed to also poke it out. Um, but, you know, after time, get used to it and poke the tongue out. But as I said, like the tongue is like a bit of a macro system. So it's quite similar to, in terms of like the pulse, it has different areas that mean different things. And again, like the top part of the tongue, so like the tip, right here, that's all got to do with like the upper area. So we're looking at like the lungs, and also the heart. The middle area has got to do with digestion. So we're looking at the spleen, stomach, liver. The spleen and stomach. The sides of the tongue have got to do with liver. So we're looking at what they look like. And then the bottom of the tongue, again, has got to do with the kidneys. And so here's my little diagram. There we go. So if you have cracks in your tongue, this has got to do with there being a little bit of like you've been working fairly hard and you've depleted some of the yin in your body. So that's something the Chinese medicine practitioner kind of knows if there's cracks, and also if it's dry. So the first thing they're looking at, is it dry or is it or is it dry and wet, or is it is it dry or is it moist and wet, and how thick the coat is. So if the coat's very thick, then we're thinking there's a bit of an accumulation of fluids in the body, and we might need to again work on the lymphatic system and work at kind of clearing some of these fluids because there's a little bit of sluggishness there. And then if you're looking at the areas in the body that we talked about, if there's any redness, that to us indicates there's a little bit of heat there. So there might be some heat at the tip of the tongue or heat which indicates there's heat in the heart or lungs, or there might be some heat, there might be some redness on the side of the tongue, which indicates some heat in the liver. The other thing we're often looking at is these kind of scalloped edges. So if the edges are kind of curvy, then and scalloped, then you might the digestion is probably a little bit weak, and we're going to be talking to you a bit about that, how we can improve your digestive system. The other thing we're looking at, and I guess this is like the cool thing about a tongue, we look at the tongue and we think, well, if this is what your tongue looks like, we're pretty kind of drawing the conclusion that if we kind of cut you open and looked at an organ, it'd kind of look pretty similar. So we're getting a real idea about what things look like on the inside. And so, like, the color of the tongue is really important. So it gives us a really good idea about blood flow, like how well blood is flowing in the body, and the quality of the blood. So if the tongue is really pale, then we're going to be like, ooh, I think your blood is a little bit deficient. Maybe your iron is low, and we're going to be kind of talking to you about how we can kind of make sure it really nourish your blood. Again, if it's really dark or even like kind of a purpley tinge, that to us kind of indicates that there might be a bit of blood stagnation. So the blood isn't moving as well as it could do. There also sometimes you might see that the edges of the tongue, instead of being red, they might be orange, which again indicates a little bit of like a blood deficiency. Or the tongue might be bright red, which indicates there being like lots of heat. The other thing is like often you're seeing some coatings on your tongue. Now, if these are just like a little bit of a light, a normal tongue just has like a light white coating, and that's completely normal. But if it starts getting a little bit furry, then that's a little bit too much, and that's a bit of an imbalance. So we want to work on clearing, because to us that indicates you've got some damp, and we need to do some work on clearing damp. So this is my little postie. Explaining all the different areas. So we've got the heart and the lung at the top, and then we've got the spleen and the stomach in the middle of your tongue. And then we've also got right at the back, we've got the kidneys. So, and on the sides, we have the liver. So poke your tongue out and see if you can notice anything. Is there any areas which are a bit red? Is it pale or is it dark? Does it have a thick or a thin coat? Is there any cracks? Where are the cracks? Like, what areas are they in? And you can do a little bit of tongue diagnosis yourself. And again, you can go into your practitioner and ask them if you're on the money or not. But it's a lot of fun. And often my patients, what I'll get them to do is actually just keep looking at that tongue over time and see how it changes, because it's amazing how it can change. Even before and after you take the needles, sorry, before you have the acupuncture and when you take the needles out, your tongue can change a little bit, which is amazing as the systems and the body kind of start to rebalance. So check it out. It's pretty cool. Poke that tongue out, have a look. We always love to hear about what your experience is. So please like pop in the comments if you have if you want to write what you think your pulse is. Also, any pictures of tongues are very welcome. If you want to give us a little picture, maybe tell us what you think there is, and we can get back to you as well. Just a bit of fun to see what's going on. If you feel comfortable sharing your tongue on this page. But look, it's all about sharing, caring, and just like learning about how Chinese medicine works and things that are cool and helpful for you, to really like make that baby. So yeah, my name's Amy, and it's been great today catching up with you all. Please, if you listen to the replay, feel free to pop some comments down, pop in a photo of your tongue. Let us know if you've got any other questions, because we'll answer them. And have a great rest of your week. I can't believe that. Can you believe it's December tomorrow? Anyway, yeah, please, get in touch if you've got any other queries. And it's been awesome sharing tongue and pulse with you. And let me know if there's any other Chinese medicine-y thingies, concepts and different ideas around Chinese medicine and Chinese medicine treatment that you want us to do a live on, and we can. Cool. Have a great week, everyone. Thanks. Thanks, everyone. Bye.